I'll give another 30 seconds or so for people to filter in. Okay. I had a long day. I'm tired.
So while we're waiting for this minute here, I'm just going to let you guys know a little something. So at the federal level, they're trying to do these what they call catch kits for women at the federal level. Okay, saying that if a woman miscarries, she has to collect it and not put it down the toilet. Which, by the way, if it's involuntary, sometimes it just happens on the toilet. But we're supposed to take it into hospitals. That's what they would like us to do. What I want is for you, as men and women, can call Congress and say, okay, if you pass this bill, what we're going to do as women is we are going to use the poor sperm quality research globally, and we are going to sue men. We're going to sue them for the miscarriages we're having and the trauma we're going through. And since Texas and South Carolina and Georgia are actually putting in Kentucky women in jail for miscarriages, we are going to do that to men. And when these men start screaming, we're going to go, oh, but this was due to your men in Congress who wanted this. So go scream at them. And you tell them that. Call the 202-224-3121 and tell them that we as women, if you pass this, are going to be suing men financially and to be put in jail because these congressmen are saying it's murder. And then they can go away from murder for the poor sperm quality because for the 3 months prior to unzipping and knowingly getting us impregnated, they were drinking, they were smoking, or they were doing drugs, which leads to poor sperm quality. Okay, that's my thing. Go for it. Because Eric's going to tell you as an MD how screwed we are with the healthcare.
Oh God. So hi everybody. Happy Monday. Another
Happy
chaotic
Monday.
Monday in the world of Trump world. So yeah, so obviously over the last couple days, everybody's heard about what's been going on with with the Iran war and this $200 billion ask from the DoD. And in a nutshell, really, they could just divert the money from ICE. I mean, they've got $171 billion in funding. They could just divert the money from ICE. And
That's the big
also
bill spending, you guys.
let me just make this very painfully clear for everybody if you have to travel like I do. TSA was not funded in the big buffoonery bill. They deliberately did not fund TSA. This was a plan that was in Project 2025 that they deliberately put through in that buffoonery bill. So they deliberately intended to defund TSA. So this is all on the Republicans. So don't believe a word of that shit out there. That, oh, the Democrats are They have literally had proposals on the floor. Thune literally had a proposal directly from the Democrats to fund TSA in full for the remainder of the entire calendar year. And they won't bring it up. And they're voting it down because Trump's like, nope, don't vote it. Nope. Unless you get the SAVE Act, we're not going to pass. I'm not signing shit. And the reality is that, you know, by putting ICE into the airports, there's something bad's going to happen. And keep in mind that all of this has basically been one streamlined thing after another. Like, I mean, we can get into a lot of shit. There's a lot of other things we could get into, but like, you know, here we are. What was it? 7 weeks. They haven't found Samantha Guthrie's mom. Like, where's the FBI? Oh, that's right. Kash Patel fired everybody. Oh, why aren't there enough TSA agents? Oh, Dodge fired 400 fucking people. Oh, why isn't there enough FAA air traffic controllers? Oh, because 3,200 people retired over the last 4 years because of from Reagan breaking the union of the traffic controllers back in the 80s. I mean, this has just been one thing after another where government has made bad decision after bad decision after bad decision, and we are all now feeling the brunt of it. And we're just getting to the tip of the iceberg, everybody, because guess what? Energy prices are going to go skyrocketing. So we're just getting started. But anyway, so let's talk about what I want to discuss, and I'm going to give AC the floor for a little bit. So, in a nutshell, why this $200 billion request from the DoD is going to change American healthcare? And the reason being is that this $200 billion request is really a clinical failure of priorities. If we want to put this into like, clinical terms, um, this is literally like our domestic healthcare infrastructure is literally getting amputated. That's where we're at, everybody. So here's the thing. So there's an 18. This is like the real deal. So NIH is flatlined. It has been cut $18 billion. Okay. And what this is when you cut NIH, You're literally halting research into regenerative medicine therapies, chronic disease, the actual advancements that allow you and I to walk out of the operating room, right? Me as the surgeon, you as the patient. Um, the 3.6 billion in reduction at the CDC level, and Angie Rasmussen will discuss this at nauseum on the CDC side when it comes to virology. But she literally, like, we're literally surrendering our surveillance system. So we are literally at risk for another pandemic. They are drilling holes, like holes that you could drive a truck through in our national security defense when it comes to our immunization health and our public health policy. RFK Jr., Casey Means is the Surgeon General nominee. I mean, these are things that just in normal world wouldn't even really become close to fruition in reality. I wrote a few weeks ago that we need a surgeon general has to be a board certified physician, not an influencer. I've written about our pharmacy benefit managers blowing holes in our system. I've written about the fact that we've needed universal health care for a while. And this is me coming from as a specialist, everybody saying we need universal health care. Like, you know, the machete approach to CMS and HHS is already resulting in coverage gaps when they don't fund the AC. Now, here's the interesting part. They want 200 billion for a warrant. They want 200 billion dollars for an illegal war that was never adjudicated by Congress or approved. But yet, there wasn't enough money for SNAP. There was no money for the ACA benefits to extend the subsidies. There was certainly not $1 billion to fund Medicaid for the year. I mean, come on. I mean, at what point, everybody, do we just need to realize that this administration is out to kill us? Right, AC? I mean, they just
Yep.
want us dead. They want us
I,
dead.
I've been typing along with you, so I didn't
I see
interrupt
that.
you, but I'm adding my
You're
commentary.
going postal over there. I mean, you're
Uh,
going crazy. Hey, Sozo. Yeah, I mean, like, literally, I have said this on many, many live Substacks. The government wants us poor, sick, and stupid.
And they really want a lot of us dead, guys, because here's the thing. AI is going to take a lot of jobs. Robots, which they don't talk about that yet, that's going to take a ton of jobs. They know climate change is real. If you go back and you look at what Curtis Yarvin has said, he compared us, the walking wards, are most profitably described as biodiesel.
Yep.
I'm paraphrasing, but biodiesel is how that's
Yeah.
all of us, you guys. If you
We're
don't have a
walking
couple hundred
flatulence.
million in the bank,
Yep.
you're the poors, you're us. And he said, haha, just joking, but really the problem remains. How do we get mass murder without the moral stigma? And I guess if you buy the media and you tell everybody that vaccines are, are killing you and you don't take vaccines, and then you don't have herd mentality because you don't have enough dumb people don't do it. And
Mhm.
then you go out and you pour a bunch of chemicals out in society because, hey, corporations will make more money if they don't have to dispose of it in a legal way. Then you have all these poisons in the waters which kill us. And in the big bill, we can't sue them then if we have health issues. And then you have this illegal war for no fucking reason. And use all this oil and all this gas will be burned up. So there's less supply issue. Of course, the military and the private equity and the oil people, they'll make tons of money. But all of that's also environmental. And then people aren't going to have what? They're not going to have fuel to stay warm for the next 2 years, are they? Europe is already looking at energy restrictions for the next couple years that
Yep.
over the winter's energy restrictions. And so, and then you have no fertilizer, which no one's talking about this.
I've been talking about it.
We get a ton of our fertilizer through Hormuz, you
Qatar.
guys. And so
Through Qatar.
right now is planting season. So here's all these farmers who have already been tariffed into the ground, who don't have any money. They're gonna have to pay what? Right, a week and a half ago, I think it was 180 more, like, per,
Yeah.
the unit that they're getting. And
Qatar
and right now
produces
it's
60 yeah, Qatar produces 60% of the world's fertilizer.
so I'm talking global starvation, you guys, and especially the poor. And what are mostly the poor? The brown, which these are eugenic assholes. And they're fine with hundreds of millions of us dying off because, hey, less climate change for them. Because if you looked at the UN putting out their statement in early 2026, we're in a water bankruptcy. So, and then they use the AI data center so they can pull up even more water. So I'm just,
1.4
and then they
million
put AI
gallons.
into our government systems,
The
and that's
average a
also,
the average AI center will use 1.4 million gallons of water a day.
yes. And we're going to be in bankruptcy before that,
Oh, we're way ahead of that.
before that.
Let me get back to this because
So,
I want
so,
want
but
everybody.
the point to this is when you're saying that they want to kill us, I'm just giving you
Yep.
aren't a conspiracy theorist. Here's some facts to back that up. And now, what can we do about healthcare? He's going to give you some more shit about the healthcare, and then I'm going
Oh,
to give
yeah,
you some
more shit.
ideas of what we can do locally. Go
More
for it.
shit. More shit about healthcare. Yes.
Well, I mean, it's shitty, like, they're just trying to
It
kill
is
us off, so
shitty.
tell you how they're
So
gonna do that.
so let me put this in perspective for everybody. So the $200 billion that Keggie's asking for represents exactly an 1,100% surplus of what's needed to keep all the domestic health agencies at the current levels, not new levels, current levels, 1,100%. Okay. It's like kind of buying a gold plated suit of armor for a body that's already suffering from untreated sepsis. I mean, it's really what we're at, right? So here's the 200 billion. Let me put this in perspective for everybody. So, we've talked about this before. So we all know what $1,000 is, right? It's 1,000 ones. A billion is 1,000 millions. We can't spend. You couldn't even if you wanted to, you couldn't spend $1 billion in a day. You could. It's impossible. But this is the type of money we're talking about. So the 200 billion requested for the Department of Justice for this fucked up war is double the entire annual budget for Health and Human Services.
Yep. Killing
I mean,
people is more important than keeping them alive, so
it's
we're gonna take money from people
right,
keeping them alive to kill other people.
right.
Holy sh
It's enough. Now, here's what really bothers me. It is enough to fully fund the National Institutes of Health for over 4 years.
Yep.
The NIH could literally fund every university and private institutional research grant for 4 years. We could literally might have the actual cure for cancer, Parkinson's, Alzheimer's, heart disease, and diabetes sitting in some lab somewhere at a university setting or in a private institution's lab, but they don't have any of the money to finish the research. We could get that done today, right? And here's the kicker. For those of you that are veterans, okay, it's enough to clear the entire backlog of all of the veterans' healthcare benefit claims 10x.
You'd actually be able to get care, you guys. Versus
Okay,
them saying what was it, 2 weeks ago? If your PTSD medication is working and you're not killing yourself, well, then I guess you don't need disability pay, and we don't have to feed you or give you housing. So pick, your medication or come off the medication and maybe kill yourself. So which
right.
is it, die or die?
And we're going to change your disability rating at the same time because the medication's working.
So you're not gonna get that money you need for your apartment
Right.
and your food.
So here's how it affects the VA, everybody. And this is what my focus of my paper. This will be published on through Blue Ant Media probably in the next few days or so. So remember in 2026 they did increase the VA budget 10%, to about $440 billion. Okay, so the extra 200 is kind of like a phantom limb. um, that this is how the national policies are completely skewed. All right, and so for those of you that aren't familiar with the VA system, the VA system has a massive infrastructure crisis. I have friends that work at the VA and they tell me shit's falling apart, whatever. But they have $170 billion backlog of infrastructure things that have to get fixed. HVACs, plumbing, electrical systems. Okay. We could literally for 170 billion, we could literally fix every VA hospital in the country, an outpatient clinic, fix them 100%, have them fully working. Um, Now, you guys might remember the thing called the PACT Act, right? Which was it's the Veterans Benefit Administration Act that they passed. So this backlog, there's a massive surge in VA claims and there's a huge backlog. So between the DAV and the VFW, that the VA lacks really the internal capacity to process all the claims that they have for the Veterans Benefits Administration. And this $200 billion investment could literally modernize the entire AI system for all the claims. They could actually get the claims paid and processed for all these veterans. But the big one is the medical research. That the medical research budget for the VA is $943 million. We're going to spend 200x on this fucking war.
Yep. Oh, here's the thing. You guys need to understand this. Unless we can take care of the problem we have here at home and oust them and turn them over to those people for all the children that they killed,
Yep.
it's not gonna be 200 billion. I want you to understand Afghanistan was in the trillions, and this is way, way worse than that.
This is worse than that. Okay.
This is way worse.
I have one more thing and then I'm done and we'll get to you because I know you have to leave early. So my point is this. So, what is the point by being the most lethal, as Kegi wants to say we are, right? By being the most lethal nation on earth, if our own citizenry are dying from preventable chronic diseases because we defunded the agencies meant to protect them. That because he wants his tippy top, right? He wants our tippy top military lethality. But like, how can we be lethal? How can we be lethal if we're all dying?
Yeah.
Remember, this country spends about half of the money on healthcare from administration and not delivery system. The Europeans and other socialized healthcare countries, literally, the money that we're wasting on administration, they're spending on diabetes and heart disease, treating it preventively, which is why they're a healthier population than we are.
Oh,
And
yeah.
this
And
is
the other
just
thing is
so
$20
basically
billion dollars.
in a nutshell, this was my article I've written. It's we're not secure. If we have to fund this, we're not secure. I'm sorry. This is this just goes right to the heart of our national defense, and this goes right to the heart of why we are so screwed because this administration literally, I don't even want to call it administration anymore. It's not even a regime anymore. It's like some autocratic monopoly government techno.
It's a hostile corporate takeover is what
Yeah,
it is.
pretty much.
It's a
And by the
hostile.
way, we're already in World War III. If anybody hadn't figured that shit out yet.
Yeah, we
So
are.
go ahead.
And in
Go ahead.
that big
It's
bill,
all yours.
in that big bill, you guys, in that big bill, they gutted our cybersecurity in half.
Yep.
Gutted it in half. And when the Democrats also wanted to fund not just TSA, they wanted to fund our cybersecurity, you guys, because we're in a war. So cybersecurity kind of a fucking important thing. And that they wouldn't even support that either. So they're fine with their infrastructure being hacked if it gets hacked. I don't know. Here's my question. Do you think the tech bros are just going to take over? We're going to pay them hundreds of billions of dollars to take over and take control? Just a question there. Because it really seems like they're sabotaging it to set it up to have that happen,
Well,
in
that's
my mind.
that's what Peter Thiel said in his little podium interview. He said, "Well, they couldn't convince the American population about how they wanted to do things, so they did it subvertly through the election, and then they did it subvertly through technology, and they
Yeah.
convinced everybody through technology that they're right."
And well, I would say this. I would say that I don't believe the November 2024 election results. I think that she won. So it wasn't. It's just about dominating. It's not even
Well,
about having us having an opinion. And I
well,
think when you look at the El Chapo people that were allowed to come in here last year, the El Chapo Mexican cartel, and then all of a sudden this year, I'm like, why did they do that? There's a reason they did that. Why did they do that? And then all of a sudden this year, we have a Mexican cartel leader in Mexico that, was killed, and all of a sudden, you guys, just coincidentally, the places being bombed are the cities that the tech bros wanna use as smart cities and control them. So, of course, since they're all bombed out, they'll have to be replaced, and they won't have the money, but you know what? They'll help out, and they'll make it all controlled by them. Isn't that just a coincidence?
it's a
Anywho,
minor
so
coincidence.
so
Just
anywho,
just so everybody, if just for future reference, so on Wednesday, everybody, the daily whatever show with Dana Dubois and Lawrence Winterman, will be the special guest for Wednesday's show, and this will hold has been a onslaught of data proving that Trump actually lost 24. So go ahead, you may continue.
yeah, I was just typing something. So there's another person on here too. It's Up to Us,
Hmm.
and that person has actually went out to people's, like, locations, called them, and people that supposedly voted in Florida didn't actually vote. Like, they're doing a lot of data as well that is backing that up. So,
No,
just
listen, we all know that this was all fucked up and stolen, and
yes, this was engineered.
yeah, it was a
Uh,
it was
um,
a technological coup d'état.
I mean, I personally think that's what Epstein was really about. I think that that this was a side action of the people, kids and babies being raped, tortured, and killed and cannibalized was actually just the appetizer for what they really wanted to do, which was the global banks and these tech bros and some of these other large people wanted to take over the world and have the world be an Epstein
Mm.
Island. Just my thoughts, because you see the tribalism that they're talking about. You hear them talk about 2008. There's Brexit. What were they? Multiple financial collapses so they can collapse the whole system. It goes to a digital ID and then a digital currency as well. So, anywho, I will go back to health. So, health. So while he's telling you how screwed we are, and I've been talking about this, you've been listening to my lives since literally the end of July. Because after the big bill passed, I was like, I
Pissed.
I was I was so upset. I was, like, crying and angry, like, in equal 100% magnitudes, so that this was going to blow up, we were gonna have a Great Depression, like, I'm like, "Oh my god, they're destroying everything." So, I've been trying to discuss this. So, here's the thing, if you ever listen to my lives, I say, "Here's all the fucked up shit," and then I say, "Here's how we can try to fix it. Okay, here's some ideas that we can start with," right? And you guys, we can modify it with your brains and your ideas, but it's a starting point that take this anger, take the emotions you're having, and move it to an empowering place. So the things I talk about and I have been putting out on my website, unitedwestand.shop, the shop of free ideas, is we need a PA plus program. And we need it in as many states as possible. And this is a cost savings. So it's something that has an ROI, which is basically this. Yes, it's going to cost money. However, for every dollar you put in the system, you're going to be saving hundreds of dollars back. So there's a reason to do it. And if we do these PA plus programs, you guys, I really think you have a physician assistant with at least 5 years experience or more with a certification of extra training. And you say, for these PAs, you say, we are going to allow them a like page worth of prescriptions that they can prescribe on their own. Only a page. Okay, this is triage, people. Okay. You have to understand these pharmacy books are inches thick. Okay, so we're not giving them full, measure to do everything. But if you go to, and specifically, I thought this through, I think the best place to have these triage areas are going to be in fire stations. And then you just have like curtains with two wheels, right? And you just have them parallel to the wall and you make them perpendicular and you get the stackable chairs out and each area gets a stackable chair. The PA and a MA will go out in a van and they're going to go to multiple different counties. Okay. And so what they do is on this day, they'll be there and you go in and it'll be free care, not the ER. ERs are the most expensive places. And I'm here to tell you, because I was putting in this chat, you guys, how this December 2026, 500 billion is going to be cut from Medicare. The elderly, 1 in 4 nursing homes is looking to go down, right? That's their estimates. And then in December 2028, after the presidential election, about $940 billion in Medicaid to the poor and the elderly and delivering babies that they want and all that. That's going to be cut. Okay. In that, there's going to be many hospitals, many ERs that are going to go down. They're not going to be able to fund themselves. All right. So here's the thing with that. This time next year, or this year we had the ACA cuts. Those people cannot afford healthcare. So they're going to be going to the ERs. Unemployment is going to get scary high. Those people are going to go to ERs. All that cost is going to be amortized over us. As soon as possible, if we can get these PA Plus programs in and you have them at these fire stations, which can be hosed down afterwards and it's disinfected. So even if someone had measles, even if someone had TB, we're not going into schools and churches and getting everyone exposed. You have people who have, let's say, they need that physical because they are going to go into this new job and they need that. We don't need that in the ER. You have a UTI, you have an ear infection, you have a bronchitis, right? Okay, well, none of that stuff needs to go to the ER. You go into these free triage areas instead of the ER because as we have ERs going down, okay, we're going to have ER deserts. Okay. We'll allow these people to have the ability to do things like antibiotics, give out antivirals, give out EpiPens, do vaccinations. Possibly, if they have a plus, an additional certification, they can give one pain pill on site, 30 minutes later, do suturing. They cannot prescribe any pain pills. If they need something after that, thanks, Casper, the website, then they have to go to an ER because they are not to be distributing pain pills, period. Okay. But that would allow suturing so that you could get that done there. And that would leave up your ERs that exist, that continue to exist, right, in ER deserts to be used for pulmonary embolisms, heart attacks, strokes, impalements, car wrecks, which is what ERs are supposed to be for. Okay.
Hmm.
This would reduce our overall healthcare costs. We need to implement things like that. I also think that, I have those letters on my website towards the bottom for your HR departments. If your HR departments now start planning for something different next year, if they were to do something like give you catastrophic healthcare insurance, which is not normally what they do, you guys. Okay. If you are healthy, you could use what's called physician care networks, which are doctors that give a flat rate. They don't use insurance. Okay, insurance companies make, was it 25 billion? I'd seen somewhere. I'm not sure if that's just United Healthcare or of all of healthcare, billion in profits per year. And that's not the
Oh, no, it's
departments
more
that
than
you
that.
find. That's probably just one company.
Oh, it's so
And
much
so what
more
I'm
than
so that's what I'm trying to tell you guys is that if we take these insurance companies out of the equation, yeah, we can still afford our healthcare if we do it differently next year. But you need to be sending those letters into your HR departments now so they can be building a different infrastructure for next year. And if you have a small company, then maybe, you also send that letter in addition to your HR department. You would send it to, let's say, Deep AI. What are the 10 biggest companies in my state? And what are their public HR email addresses? And send it to them because they can be building out physician care networks now. Doctors that just use a flat rate, they bypass insurance.
direct
And
pay
that way
pay models.
we could do that, and you know what we could do is and I have a different letter in there to your, blue governors, you guys, and you need to be sending that in, and that has, like, 10 different 9 or 10 different points on it. One of them is can you, at the state level, give us bulk discount rates for the catastrophic healthcare insurance and the international healthcare insurance? Because that way, even your small little businesses could way more afford giving insurance to their people. Okay, and what is that insurance? That is catastrophic insurance. So if you had, let's say, a heart attack or your whole family got in a car wreck, catastrophic insurance would take care of you, right? That's not a flat rate thing. That would take care of you so you don't lose your home. And then if you have, let's say, a long-term issue, let's say like you have an organ transplant, let's say, and you need additional care. If you're on dialysis or if you, right, like maybe what you have to do is you have cancer treatments, you have infusions. I have an autoimmune disease. Later today at 5, I got a word back, it's at 5. I'm gonna have an infusion today, okay? And if you have something like that, maybe you need to just jump border a couple times a year and get that kind of medication. So, that's how we can afford our healthcare next year. I wanna give you, like, empowering things that this is how we have a tsunami coming towards us, yes. We're trying to tell you is this pocket, there are some ideas if we work differently, if we think outside the box. I'm neurodivergent, that's something I can do. We can use these outside ways of dealing with healthcare. It is not going to be a catch-all, but it will save a lot of lives, I think. What do you think, Eric, from being inside the medical as a doctor about this direct physician care, and what are some of the obstacles that would be there that we would need to overcome to make that happen?
So, as I said last Wednesday on the Blue Ant Media podcast, that was one of the questions that Cliff and David asked me. Like, out of the 3 miserable components of our healthcare system between pharma, hospital, and, insurance, which is the one that's the most evil component, right? And it's really the insurance industry is probably the most evil component of what we have to deal with. They're the ones that literally have completely, basically hijacked the system and have inserted themselves between the patient-doctor relationship. You know, if everybody remembers back in the '70s, every healthcare insurer in the country was a nonprofit, every single one.
Until the GOP said we should make it profit.
It wasn't even that, it was before that. It was basically when they decided back in the mid '70s that they were gonna go through this new they started adopting the Kaiser Permanente HMO model that was developed in 1948. And they started figuring out a way to slowly put on, like, that was kind of like in the mid '70s is when you first started seeing provider networks. You know, "Oh, we're gonna sign physicians on specifically to our networks so that we lock them into a contracted rate." And that's kinda how they started, and physicians in their infinite stupidity, way before I became a physician, by the way, um, you know, thought of it as a way to make sure that they had patients coming to their office because they were a network physician. They were in the book, so to speak. Okay. You have a company like Aetna, which now owns CVS. They own the clinics. They own the pharmacy benefit manager. They
That's what I
own,
just put in there. That's what I just
yeah.
put in the chat.
Oh, you did. Yeah, okay. Yeah. I wasn't looking at the chat. So, and now they're actually physically buying medical practices. At
Yep.
some point, every medical practice in the country will be run by either a corporate institution company like Aetna, United Healthcare, or will be a capital management firm that owns the group through a hospital system. I'm already seeing that in Florida. They have already looked at me and said, "We can't afford you." And I said, "Yep, go fuck yourself, because I don't want you. I'm not working." The one thing that my a CFO told me a long time ago is never, ever, 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 ever give up your autonomy as a physician. And that has rung true up here for the last 25 years. I would rather close my practice than be a sellout to corporate interests big big pharma or big, hedge funds buying up capital investment groups, buying up physician I no. I You're not gonna tell me how I'm gonna do my job and then tell me when I do my job that it's not making you enough money because of the type of medicine I practice. Go screw yourself. I take care of patients. My job is not to make you money. My job is to make myself money through the work that I do, and that's my job. My job is not to make some guy sitting in some ivory tower, who bought my practice and thinks that they own my ass. No, it's not how this works. I am the wrong guy. Wrong guy.
You're the right guy, Eric, and we need like a
I
million more of you.
I listen, I wish my colleagues had more chutzpah and balls. I swear to God. They have sold I've watched, because what they do is they trade their independence for security financially, and then they realize they went, "Oh shit, I screwed up." I have colleagues of mine, and for everybody that doesn't know, I'm a podiatrist by trade, but like I have friends of mine who sold out to Upperline Health. Upperline Health is a um, management firm for foot and ankle surgeons, podiatrists who have sold out their practices, say in like Northern Florida, and they are regretting it. I mean, yeah, they're making 200,000 a year, but like they are unhappy. They are miserable. They're
Because
like,
it's
"I
about the profit,
never,
not
ever, ever
helping
should have
people.
sold my practice."
I know that I talked to a PA a long time ago because I thought about becoming a PA, and, he told me something. He said he was working for this doctor, and the doctor was basically there once a week, and it was really the PA that ran the place, and
Well,
he would just come in.
you're seeing that now. You're seeing a lot, and what's happening is by doing that, because here's the deal. Ready? And this is the secret, everybody. Nurse practitioners and PAs bill at 85% of Medicare.
Yeah,
Not only are they less money to hire,
yeah,
but they're also less money to employ. They're
mhm,
less money on, and what happens is there's still a physician that oversees them. So some of the billing gets done, some of the higher billing coding goes through the doctor, even though he may not have seen you. It's called direct supervision or general supervision, and
yep,
that's how you get around it.
and so this
As
is
long
what
as
they
the
were doing, which is
physician's on site, technically the physician is still the physician of record. Even if they're on site, they never have walked in the room, never saw you, they can still bill services, even though they've
right,
never technically seen
and
you.
so that's what this doctor did is they were basically I'm gonna say retired. They came in once a week. They signed off all on these prescriptions. That was it, and the PA ran the place.
Pill
And
mills,
but the PA said this is what the PA said. He said, "I will have," because he's fighting with the insurance companies to get
oh, big shot,
testing that was required to be able to
big shot,
treat his patients correctly.
big
And
shot.
he was very upset about that. And he said, I'm gonna tell you how you get the insurance companies to pay
Hmm,
because I've used it several times." He said, "I've had patients, like where he was at, there's a lot of diabetes." And he said, what they do is I'll ask, and it gets to be like 4 or 5 months in, and these people are on the verge of, like, they're gonna lose their arm, they're gonna lose their leg, something's gonna happen here. So they ask for the person's name, and they say, "Well, they don't wanna give the name." "Well, I have to have the name because I'm gonna be giving this to the patient, and when they lose their arm, they're gonna sue you directly, because you're not a doctor and I am, and they need it." And all of a sudden, you guys, it's like magic. All of a sudden, the insurance company
Not so magic,
approves
Casey. I hate
the
to break it to you.
testing, the
Hate to break it to
testing.
you. It ain't so magic. Okay.
I think it's called sarcasm, but anyways,
Well,
so
no, no. I mean, here's an example. Ready? So here's an example, everybody. This is a denial letter. Okay, for a patient. So just I'm going to give everybody a little inside baseball here. Okay. So this is from one of the evil empires. Okay. So this is a patient who has Medicare, full Medicare Part B, who has a employer sponsored Medicare Plan F. Okay. So this is a Medicare supplement, not a Medicare Advantage. They have regular traditional red, white, blue Medicare, and then they have a Medicare supplement through their employer. So this was a overpayment request from the Medicare this is from the supplement insurance, which by the way is illegal under 42 CFR 1315. for a Medicare supplement, even if it's an insurance-based supply, even if it's an employer-based plan, to request money back on an overpayment on a claim that Medicare has already adjudicated. So when Medicare being the insurer, primary insurer, they have already made the determination of medical necessity when they adjudicate and pay the claim. Okay. So these motherfuckers want like $7,000 back from me over a period of like, say, like 5 treatments. And this patient had a diabetic foot ulcer being treated. I did skin substitute grafting well within the standard of care on a product that I wrote the actual RCT evidence on. So they're asking for overpayments on a product that I wrote the randomized control trial for. That I was the primary author, I was the lead investigator. We did 150 patients, level 1 randomized control trial. So I basically send like this 11-page letter back to them. This was their response to me. Everybody can read the first line.
Unfortunately. I see unfortunately.
It's right here. Basically, in a nutshell, it says,
They want their
"We
money. They
reviewed your
want their money.
documentation and find that the overpayment refund request remains valid." So here's my response. Okay, fine. But here's the thing. So in my original letter, and that's why I'm going to answer Deb's question real quick. They are basing their request. Here's what's hysterical. So they're basing it on the employer member benefit does not pay for non-covered services. Well, it doesn't fucking matter because they're Medicare Plan F. It doesn't matter. I don't care if it's an employer-based plan. You're participating as a Medicare supplement insurance. It doesn't matter. It doesn't matter. It really doesn't. You have to comply with Medicare law. Okay. Now, here's the best part. Okay. If everybody can see this little number here, this is great. I love this part. Let me see if you guys can see this little number right here. Right there. Okay.
Yeah.
Okay. So this number refers to a policy under United Healthcare. It's called 2025 T0592CC. This is the policy they're referencing. Well, I encourage everybody to go ahead and Google 2025 T0592CC.
Okay, that went really quick if we're supposed to be Googling it.
Right? I know. Hang on. So this
2020
policy, hold on. The policy literally refers to, and I swear to God, everybody, I am not making this shit up. This policy refers to a multiple payment reduction for radiology services. Now, they wanted the policy to reflect wound care services with a diabetic patient regarding a cellular tissue product. The policy they reference in the letter has nothing to do with it. The other part of the letter refers to the NIAC guidelines, which is the National Association of Insurance Carriers, who has no fucking jurisdiction here whatsoever. So they basically kind of threw this AI letter together, through a policy that doesn't make any sense, has no application to what I did with the patient, and then NAIC guidelines, which has no bearing on Medicare law. This is the shit that I am putting up with every fucking day.
And these are the things I'm going to say with this. Number 1, everyone out there who's listening, what you do is you ask for your bill. You want an itemized list of your bill. And you need to go through, you need to go through step by step and look at what you were charged for, and you argue against the things that you're being overcharged for.
Well, wait a minute.
You need to do number 1.
So hold on. So hold on. You're writing for one way. Okay. There's 2 things with that. So there's always the physician charge or the charge for the services. Then there's the contracted allowable amount. I can charge $1 million for something, but if it only pays $100, it doesn't matter about the $999,900 I bill. That's an automatic write-off. I cannot balance bill you for that. When you are a network physician and you take Medicare assignment or insurance assignment, you are agreeing to the network rate, period, hands down. So it doesn't matter what the office bills. It's irrelevant. Okay. It only applies if that provider or the hospital is an out-of-network provider. Then they're not bound by the contract.
I was looking at hospital bills, and I'm looking like, no, that is not, because
Right.
we've had hospital bills like going in for a couple weeks.
Hospital bills are,
And so,
it's the same principle though. If the company, the insurer is in network with your hospital, and this is the other thing too. So just remember, when you guys go into a hospital, I want to make this very clear for everybody. The hospital can be in network. Okay, but let's say you go through the emergency room. The ER physician group might not be a network. The pathology group might not be a network. The anesthesia group
The
might not
anesthesia
be a
groups
network,
usually are not.
right? There are 4 there are usually 4 departments in a hospital that they contract out, that are outside the hospital. They're not independent contractors. They're not like physicians in the community that have private offices or private practices. They usually contract out emergency services. Those are usually contracted out to a third-party company. The other one is anesthesia services,
Yeah, that's
pathology
always
pathology services, and radiology services. Those 4 departments in the hospital are always contracted out to third-party groups that supply the hospital under a contract.
so when you're talking about getting, uh, an operation done, you guys, if it's not like an ER kind of thing, I think what Eric's really trying to tell you is you need to talk to your doctor and make sure that the anesthesiologist is gonna be with the network, the radiologist is gonna be right? Like, ask them if there is a choice and check so that you get less of a bill later. That might
And
be
and
something
you
really
sign all
big.
these things, and they'll usually notify you when you enter the hospital. When you enter the hospital, they'll say, "Oh, this anesthesia group's out of network. Are you aware of this?"
'Cause I didn't get that information, so
You're supposed to under
and
federal
we
law.
got it after the fact, so I'm just saying
By
those
the way,
might
I'm
be some
sorry,
things
Asa,
to
did
check
you
out.
need to go? You said
No,
you had
I said I contacted this person and they said it'd be 5, so
Oh,
we
okay,
I like I said, I yeah.
okay.
I have a day, but it was supposed to be earlier in the day, and then it got pushed back, and then I was supposed to be doing this with you, and so then I asked, well, if we're gonna push it back, can we push back just a
Well,
little bit later?
you could have
So
rescheduled this.
we're good. So no, I'm good. So anyway, so here's the thing, you guys, is this, is honestly,
Delaying her
um
healthcare, everybody. I want you to understand that. That's what she's doing. She's delaying her healthcare.
no, it's fine. Anyways, so here's the thing with this is that, I feel like if you're listening to Eric too, you're hearing the frustration from his end. And so I really think that there would be this real
There's no
con-
frustration.
there could be this and here's
Right?
in what he's talking with the AI, now they are embedding the AI in there. So the AI companies, what they automatically will do is they will say, okay, well, you're supposed to get A kind of treatment. Well, they're going to automatically downgrade you to B, and you have to fight to get to A, which is what you really should have. And any of the cost, right, that they are able to squeeze out of you, right, the AI, they're going to get paid a percentage of that. Okay. And
So yeah.
if we want to
So
like stop this shit, what we really need to do is just take the insurance out of the equation. And
pretty
so
much.
really going to your governors and asking if they can't at least at the state level. Look at what Oregon is doing because they're trying to put in universal health care. You can try looking at that. But could you at least, at the very least, give us bulk discount rates for catastrophic healthcare insurance and for international healthcare insurance for people who have chronic illnesses? And give us that bulk discount rate. So that way, even the small little employers have help and they automatically know what they can do. And the flat rates for the doctors, because the doctors like Eric here will not have to deal with, oh, the CPT code and this AI. And then we have to fight to get the treatment. And once we get the treatment, I actually give it to you. Now I have to fight to get the money for the treatment I gave you. That all of that bullshit and headache can go away.
So
And it will be easier for them and it'll be cheaper for us.
right.
And we
So
can then
here's
actually focus at preventative healthcare.
right.
Imagine
So
actually focusing on preventative healthcare.
what everybody has to understand is our healthcare system is built on a reactive model, not a preventative model.
Yeah, that's what I just said.
Okay. So what's happened is our system of healthcare, which originally is designed from the Social Security Act and the Medicare Act, and all of that has basically determined our system. And because they are because they've basically haven't figured out a way to uncork this whole reactive medicine pathway because there's too many special interests between hospital lobby, orthopedic lobby, anesthesia lobby, general surgery lobby, plastics lobby. The AMA is just as guilty of all this. The AOA, the American Orthopedic, Osteopathic Association, the APMA, even my parent organizations fucked this up. Um, this is where we have to kind of figure out a way to uncork all this and unscrew the. You can't unscrew this, but you can fix it. The fix literally has to be we need to basically overhaul the entire healthcare system. And it's going to be painful. I'm sorry. There is no way to fix systems without it being painful. And there has to be major sacrifices. And part of it's going to be everybody's going to need to understand that this is going to suck for a couple years. Okay. I know that, when we do our shows on Thursday and Nick and I and Walter and Evan are telling everybody to just suck less. Unfortunately, this is the part that's going to suck because it is a comprehensive metabolic, physiologic, and psychological change about how this country delivers healthcare. And the only way to get out of it is to truly overhaul the whole fucking system. The problem is that there's too much outside money that yanks on the strings that prevents that from happening because our legislators are too fucking feckle and they're too weak and they're beholden to special interests and dark money. And that's why we are going to fail eventually as a country. Why this grand experiment is going to goddamn fail because the people that are running it are inherently flawed.
So
Now,
I think my personal thought though on this though is like I said, if we were to use flat rate physicians, direct physician care, okay, we the people can go out to these doctors and say, you don't have to deal with this, this, and this. We can give you flat rates. Okay. If we can get our governors to do the bulk discount rate for catastrophic healthcare and for international healthcare, okay, and that right there would probably kill United Health. And when you start killing United Health, the other insurance companies are gonna like shit their fucking pants. And they're gonna heal too, because if they don't get on board with doing the right thing, they're just gonna go the way of the dodo.
well, why do you
And
think people are stuck in jobs they hate?
health care insurance,
Because
Germany
health
doesn't do that.
care
They do job
insurance
sharing.
is an anchor.
Yes.
This need to have health insurance is an anchor for a lot of people, and they're stuck doing jobs they fucking hate. Imagine how many people could be doing the things they wanna do, but are stuck because of health insurance. I have to stay on the health insurance. I can't listen, my wife is like this. I love my wife. She's been flying for JetBlue for 26 years. She's wanted to retire. She can't because of healthcare. We need the insurance. Because just to insure me alone on my own, even with my practice, it would run me 1,200 a month. And I feel for everybody out there who's paying a lot of money for insurance.
And
I
what I'm trying
It's
what I'm
ridiculous.
trying to tell you guys, because 'cause I'm trying to incentivize you. I'm
Mhm.
not trying to scare the shit out of you, I'm trying to incentivize you.
No, we're trying to scare the shit out of them too. Don't that we talked about this before we went on. Part of what you and I do is to scare the shit out of people.
Well, I think when you look at the ACA and you look at what they're going through right now and they're working and cannot afford their healthcare,
Yep.
okay? And if
Look at
in
TSA,
this
they're working and can't even afford the healthcare because 'cause they're not getting paid.
right, so when you look at this Trump world, now they can come for your house and everything, okay? This will be all of us next year. This will be all of us because 'cause I'm telling you, unemployment is gonna go run rampant. Nobody's buying our product because everyone hates us, okay? And that is the plan from a bunch of assholes. Okay. So when that happens, you guys, and they all go to the ERs this time next year, we will not be able to afford our health cares if we do it the old way. So what I'm trying to do is go to my website, unitedwestand.shop, a shop of free ideas. I don't sell a damn thing. Okay. You go in there, you scroll down, and you're going to see two HR letters. It'll say an HR letter, right? Send it in. One is for your retirement, which right now, if you haven't sent that in already, you're fucked. Sorry. Should have been doing that the last 3 months that I've been saying it. And number two is the healthcare, which you are not at this point screwed with. So please go send it in. And again, send it to at least 10 different large companies in your state. Why? Because your small and medium sized companies do not have the resources to look into direct physician care, but your very large corporations would. And if they do it, the small and medium sized companies can tag along and use the same doctors. Okay. And so I'm just saying, go in there and it is literally these are free things you can do. There's a letter in there to your governors. If you have a blue governor, send it to your blue governor. It's like 9 or 10 points. I put that in the last 48 hours. Okay. Because I seen someone say something to the governor. I'm like, hey, I have a larger thing. What I want them using this. It's called a constitutional restoration escrow. They need to use it now. So these taxes in the next couple weeks are not sent to the federal government. They're put into an escrow that is legal, and we withhold our money from the government. And that money, maybe we can use that for our healthcare and feeding people. What a fucking foreign concept to these assholes. Okay? But you need to be sending in now so that we can get some results. I need action, people.
I hate actually.
Sorry. 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 Shotgun.
I want everybody to catch the last line. I need action. From a camera
What
off,
is
I need
yeah,
action.
why you keep shitting on me? I'm bringing you some good ideas. You and here's the thing,
Because
Eric.
you know
This is
why? I'll
this
tell
is
you why.
this is how much I
Because
piss off this is how much I piss off the oligarchy. They're freaking muting my shit.
that's why I
If
brought
I
you on. They don't mute me yet.
yet
Well, you know why? Because everything I do, they can't. What are they going to mute me because I'm telling the truth as a physician? You're really going to silence me? You start silencing me, that doesn't go real well.
yeah. I started looking at Zoom. I'm like, I'll just do Zooms.
Yeah, and if you pay for it, they can't silence you if you buy a pro package
So,
because now
yeah,
you're a
I mean,
customer.
they can
I
keep
mean,
trying. I have
listen, they're
everything on my
not
website
listen.
too.
Listen, I know they were doing a lot of technical updates, and that could have just been you could have just been falling through the technical crack last week. Like,
Your
I mean,
weirdo friend, they deleted her whole blog on
well,
creating
yeah, well,
mutual organizations.
that's because of the topics she talks about. When you start talking about training, and then those are things that tag the NSA.
What
So
is what? Because all I heard was that she was doing the mutual aid, which I have the daisy chains on my website.
yeah, that's all she was talking about. But somehow, whatever she said triggered. So listen, this it's one of the reasons why I said if you publish on Substack anything, you join the National Writers Union because, like for me, I don't make any money off of what I publish. So because I
Right.
don't make any money, it's my premium's low as a published author, internet content creator, if you want to call it that way. And then I also not only do I get the benefit of my First Amendment right of free speech, I get it under the press as well. And then I actually just sent it's nwu.org. Um, and then basically and then I just put in for I'm waiting to get my press card. So, and I'm going for my international press card, so it doesn't matter where I am. I'll have basically and by the way, just so everybody knows, Supreme I forgot it was a I think it was an appellate court just ruled in favor of the Pentagon Press Club, the press corps for the Pentagon.
So
So
that
the judge
come back
ordered the
in.
Pentagon that they have to reissue all of their credentials immediately. So that was a win for journalism, by the way. Thank you. So
And yet they still haven't
thank you
shut
to
down
the
the
New York
executive
Times, thank
club
you to
where
the New York Times for all the evil shit they publish and the stupid shit they publish. Thank God to the New York Times for standing up for journalism and defending that lawsuit and going after the Department of Defense and going after Kegi because, they fucked up and now they're held accountable. So we're not, listen, the courts are holding everybody, believe it or not, they are holding. And I know that
other than SCOTUS, federal is.
right, and I really do think that I know SCOTUS is hearing, I know they're hearing the case tomorrow on the Mississippi, ballot issue about when ballots have to be postmarked. Um, the one thing I will say about SCOTUS,
Yeah, but they did pass that one thing where if they
except for Alito and Thomas, okay? Um, I do think that the majority of the members of the court understand that the right to vote is literally one of those things that's so enshrined in the Constitution, regardless of color. I mean, the Voting Rights Act aside and all the shit that they've gutted and all that stuff, but I think they still have not gotten to the point where they are willing to cross the citizenry and say that your vote is not allowed to be counted. That's the one thing that they have not crossed yet. Alito has, and so has Thomas. But Kavanaugh hasn't, and Gorsuch definitely has not. I mean, I think at the end of the day, when you start talking about disenfranchising a single citizen in their right to vote, by not having it count ever, because of a date timeline in the mail service and things that as long as they've submitted their ballot, like I think the minute you start crossing that line and you start disenfranchising citizens of their basic constitutional right, you're crossing a line that really just, I mean, you're crossing a major line constitutionally.
it's the Rubicon. It's the
It is
Rubicon.
it is a Rubicon.
You've then become a dictatorship, and then the people revolt.
And listen, they were willing to do Trump's bidding when his numbers were strong and everybody was like supporting him. But now that he's freaking weaker than shit, his numbers are like submarining faster than Subway.
And here's the other
Um,
thing is, it's not
you
just
know,
us, you guys. If
No.
you're the small little millionaires, you're screwed. And they're starting to wake up to that. And guess who
Yep.
they are? They're the donors. And that's what's starting to like break a little bit. But if you guys want to go back to the post I did today, there's 2 things I put up today. One was in regards to, again, they wanna do catch kits for women. If you're having a miscarriage, you have to bring in the blood and remain like, just blood and tissue. That we need to have a separate law, right, where we actually catch what they're masturbating to, right? Because those are millions of souls, people, and of course they won't do that. So you're like, "Okay, that's fine. If you're gonna pass this law, just understand that we're gonna use poor sperm quality research done globally, which you cannot scrub. We'll put that into the court cases, and we are gonna start financially coming after men for putting us through the distress of having a miscarriage due to their poor sperm because 3 months prior to unzipping and willingly and knowingly knowing they were gonna get us impregnated, that they did drugs, they smoked, they were drinking, and that caused poor sperm quality, and if that miscarriage happened, they are considering that a murder, and they're putting women in Texas and Georgia, South Carolina in prison. Well, then we need to go after these men for that. And as soon as men start actually being held accountable in the court of law, oh shit, they will turn that shit around. The other thing is this morning, if you guys would like to actually help with taking the pillars down, there is a Kate Justice on here, and she actually put out this information on how you
Yeah.
can do investigative reporting on your own. I have the link in there. You can get that, download it, give her a couple bucks for that. And then I say, hey, by the way, we already know that we have 2 investigations of some of these congressmen right now. And we already know, I personally think Lindsey Graham and Jim Jordan, you guys, quick question. Do you think they're dirty? Question mark. We could investigate people like that. And
That
we
was
could say, hey,
Oracle.
send this send this information to your blue AGs. And you know what happened to Matt Getz when they started investigating him? He resigned immediately because he didn't want to be prosecuted. Isn't that
Yep.
crazy? Do you think that these other Republicans, do you think that they would resign immediately? We only need 3 or 4 of them to do that. We flip the House, you guys, and shit starts turning
Oh,
around. Would you like
speaking of
to
which,
be a part of that?
I wanna share this video real quick because, um, I wanna share this video for everybody if they haven't seen this yet, okay? So, everybody see this?
Nope. Yep. It's Yep. Yeah. It's horrible. Hate this shit. You guys video this. If you get anything, you video all this.
Yeah.
No badges, no arrest
So,
warrant.
both of these officers are already in violation of federal law by not identifying themselves immediately.
And just so you know too, you guys, there are 12 and 13-year-old girls that they're keeping separated from people at the camps, and they're turning up pregnant.
Yeah.
And then they're moving them to Texas where they have the anti-abortion laws.
Just keep watching. This goes on for, like, another 20, 30 seconds.
On my website, you guys, if you go down, there is a part that's for, specifically ICE. Maryland right now has a website that anything like this, you guys, you turn into them because they are going to start prosecuting. If you have any other websites from, let's say, Illinois or New York that you're finding that I haven't seen yet, DM me that information. I will add that to my website too. And if you're from those states, even if you're not, hell, it's somewhere to upload it to. The other place you can go is .org, I think it is. And I think you can upload there, but I'd like to have it at a state level that I know that they're actually gonna prosecute it. So that one is on the website, you guys. If you have any other websites, let us know. But you guys need to be taping this and sending it in. When these guys actually start being prosecuted and thrown in jail and their houses are taken from them, that will scare the shit out of these betas.
Just remember, like, there are things that, like, if you get into a situation like this, and there are things that when you encounter ICE, for example, okay, the things you do not ever have to tell ICE, okay, you never have to disclose your naturalization status. Whether you're a US citizen or legal resident or not, it doesn't matter. They don't have every right. You can refuse to say where you're born, okay? You don't have to answer how you entered the country. You can refuse to disclose your home address, okay? And you do not have to provide any information regarding the rights about the whereabouts or anybody else, okay? Do not say a fucking thing. It immediately ask for legal counsel. You say, "I refuse to answer any questions. I am exercising my right to remain silent, and I want an attorney now. I want to contact my attorney." Okay. Also, ICE does not have the right to search your person or belongings if you're in public. They don't have the right to go through your bag, and you have to say, I am refusing any search under my Fourth Amendment right. You have not provided a warrant, and you do not have probable cause. You've detained me in public. You don't have the right to search me. Okay. And whatever happens, if it's at your home, do not open up the door. And remember, it has to be a judicial warrant,
And a
not an
judicial warrant
administrative
is
warrant.
signed by a judge, and you guys on that website, if you funnel down, it's like brown, black, and gold. There is this piece of paper that you can take a screenshot of, you can print it out, and it is one of the best ones I've seen. It's like Castle Doctrine and says you can put that up at the beginning, at the entrance and exit of your business, your house, and if you have a pillow in your car, your car. And what that allows you to do is say they are not to access it. And if you take pictures of that with the date, all right, and you have that, that's evidence in a court of law. If they come in later, hey, I have this. This was the date I put it up. This is the date that they had me. They knew full well they weren't supposed to do this. It's just another line of defense for you.
So let me just say this real quick. So for those of you in states like Alabama, Arizona, Florida, Georgia, Indiana, I think it's Kentucky, Louisiana, Montana, Nevada, Oklahoma, Texas, Utah. There are extended rights on castle doctrine where have very, very, very strong protection for castle doctrine. Okay. And this is basically
I,
castle
I have to
doctrine is on.
I have to go. I'm sorry.
All
You
right, go
guys
ahead.
have a
I'll
great day.
I'll plug you afterward. I got you.
Okay,
Okay.
bye.
Bye. So for everybody, just understand castle doctrine extends to your personal vehicle. As long as you are parked legally, as long as you are in a legal parking space, you're not in a public parking lot, okay, and you are inside your car, they cannot force you out of your vehicle. Like if you are on your driveway, that is castle doctrine, okay? If you are occupying the vehicle legally, and this is the trick, it's got to be legally, okay? So so when it comes to specifically about like castle doctrine in Texas and Florida, the law does presume that you have a reasonable fear of death or serious body harm if someone's breaking in. So let's just say I'm in my car, right? I'm parked at my house. I'm sitting in my car, and ICE officers walk up to my vehicle, start trying to break in the car, and I happen to have a weapon, which I usually do, and I definitely shoot one of them dead, or I catch all of them dead. I can't be held responsible because I was in my car legally on my driveway. Now, if I'm parked in the street, or if I'm parked at, say, a public parking center, that's not where it applies. Okay. So that's just castle doctrine, everybody. Just, I know she talks a lot about it, and the legal protections about in your vehicle, parked legally, and not in the public area. That's castle doctrine. Um, they're still going to arrest me no matter what. But the deal is, if you get detained by ICE, and then let's just say they take you into a detention room at the airport, and basically, do not never answer a question, never repeat where you're from, where you were born, your citizenship status. You don't have to disclose your address. You certainly do not have to subject yourself to a search. Okay. And if you ask them, am I under arrest? And they say no, then you say, am I free to go? And if they say yes, you get your stuff and you walk away calmly. And that's it. That's all you have to do. If you are going to be detained, you say, I do not consent to searching, and I want an attorney before they even do anything else. And do not sign any documents before you leave. Just say, I'm not signing anything without legal counsel. So you guys have every right to, I mean, just know your rights as a citizen. Not that that helped Renee Good, Alex Preddy, or what's his face? Crap, I can't remember his name. Oh, Porter. They were just killed. And the other 38 that we know of detainees that were in ICE custody that had their rights violated. So, you know, that's basically how that works. So, well, I really appreciate everybody hanging out for the last hour or so. I know AC had a jet, so you can subscribe to her Substack at American Citizen. I know she's not here to shamelessly plug herself, so I'm going to do it for her. So you can reach out to her at American Citizen at Substack. She has a lot of good stuff on her UnitedWeStand.shop website. Um, and you guys just need to follow the people that are giving you information. Most of the stuff I give you is more about healthcare, but she's really good when it comes to like the national security defense and your own personal defense and how to activate with your local governments. And there's a lot of good stuff on that on her site, which is UnitedWeStand.shop. I'm putting it back in the chat for everybody. The other website she had put in here was the PSST I think it was .org. Um, and then there's a lot of other really good, valuable people on here that we talked about earlier in the stack in the live. And then you guys can follow me right here at Substack at Dr. Lullove. Um, Cheryl, my pod. You'll have to define pod. I don't know what you're meaning by pod. So anyway, um, so my Substack is here. I have no paywall, neither does American Citizen, so it's absolutely free to subscribe and follow to me. And then you can always follow my work on Blue Ant Media. Oh, my show. My show is so I do a couple shows a week. I do a lot of live interviews with people. I don't have a set show on Blue Ant Media yet. We're still working on scheduling and timing and all that stuff. But you guys can follow me on Thursday afternoons at 12:30 p.m. with Nick Perro and Evan Fields and Walter Ryan on the Sick of This Shit Productions, and where we do our Diogenes Club at 12:30 on Thursday afternoons at 12:30 p.m. Eastern. And we just kind of like four guys trying to break the manosphere. That's all we're trying to do. And again, you guys can follow me here, no paywall, so feel free. And you guys can catch my writings on Blue Ant Media and through Sick of This Shit Publications. And I really appreciate everybody hanging out with me today. And thank you to American Citizen for being on with for the hour. And hope to see you guys soon. And you can also follow on defiance.org and Miles Taylor's organization. That's another really good site if you guys want to get involved is Miles Taylor's organization, which is defiance.org. I just put that in the chat. Um, and everybody, if you're going to No Kings this weekend, enjoy yourselves. I have to be traveling, so I will be missing the No Kings events around me. But go on nokings.org and you can sign up for your local area. A lot of the places require you to RSVP and register for it. So make sure you do that. And everybody stay vigilant and stay defiant and stay true to yourself and just be good American citizens. And don't forget to vote. And don't forget to remember, if you don't vote, you can't bitch. But just stay informed and keep reading and be advised of everything that you need to know about, because you guys are the power. We have the power, and the power lies with us. So everybody have a great evening, and I'll see you guys soon.